everyone, I have recently become very interested in MDMA. I decided to make this video to describe the use of MDMA-assisted psychotherapy in treating PTSD, as well as the results of recent clinical trials testing its effectiveness. Before I talk about MDMA, I'll describe a little bit about fear memory and how improper fear can lead to PTSD. Our minds are always taking in sensory information about our environment, such as odors, objects, sounds, etc. During a traumatic event, our minds associate stimuli in the environment with the emotional response to the experience. Because of this, when these stimuli are encountered again, it reactivates the memory and triggers a fear response. Around the time of the event, this process can be very helpful. The environmental stimuli lets us know what things to avoid and what actions to take to prevent re-experiencing those experiences. However, in some people, the stimuli can continue to trigger fear responses long after the event has passed, and they are in a safe environment. This condition is referred to as PTSD. For example, a soldier who fights in a war must learn to take action when their life is in danger. Gunshots and explosions endanger the soldier's life. In order to respond as quickly as possible, the soldier learns to associate loud noises with gunshots or explosions. This association allows rapid triggering of fear and stress responses that can allow the soldier to take fast action and survive. During the war, this is adaptive. However, in some soldiers, this association continues when the soldier returns home. For example, these same sensory stimuli such as loud noises, smell of smoke, and sight of fire are also present when enjoying a campfire or celebrating the 4th of July with friends and family. The smell of smoke from the fire or the sudden loud noises produced by the firework can trigger an intense fear and stress response despite being in a safe environment. This condition is what is referred to as PTSD and can cause serious deterioration in quality of life. It affects 7 to 8% of people in the US. However, current therapies and treatments are ineffective in many people with the condition. Because of this, better treatment strategies are being explored. So how are MDMA therapies carried out? Typically, 2 therapists hold several drug-free sessions with the patient in order to foster a feeling of safety in the environment and comfortability with the therapist. These sessions allow the therapist to prepare the patient for what he will experience under MDMA. During the MDMA session, the patient is given 2 to 3 active doses of MDMA. The patient is encouraged to process the trauma at their own pace with assistance from the therapists. Eventually, the patient becomes enveloped with feelings of empathy and safety, and these feelings in combination with therapy are believed to work synergistically to create a clear perspective of the trauma as a past event. The patient then stays overnight, and a session is dedicated to reflecting on the MDMA experience. Several clinical studies have been carried out over the past few years demonstrating the effectiveness of MDMA-assisted psychotherapy. The first placebo-controlled study was done in 2010. To measure severity in PTSD patients, they used the CAPS score, which is generated by a therapist from an interview with the patient, and a IASR score, which are reported by the patient themselves. They measured these scores less than 4 weeks before the MDMA session, as well as several days after and up to 2 months. The single MDMA session produced a dramatic decrease in scores over the 2 months. These results spurred the onset of clinical trials. Recent results from 6 phase 2 clinical trials show 83% of patients showed improvements that lasted 1 year, while only 25% of the placebo group showed the same improvement. The effectiveness of this treatment lasted an average of up to 3.5 years. The positive effect of MDMA on PTSD symptoms were only present when taken in combination with therapy. When taken in the absence of therapy, MDMA may potentially exacerbate these symptoms. Here is how a few patients describe their experience. "It gives you euphoria and love. You can go into darkness and not be afraid," he said, referring to addressing the trauma of war. "Under the influence of MDMA, I was able to talk about and work through these things without having that physiological reaction," he said. "It kind of rewires the brain back to baseline before the PTSD. I felt as if it was literally reprogramming my brain and confronting all the fixed thought patterns and belief structures that were keeping the PTSD in place, that were making me relive the past over and over again. I was able to file those memories in the past." The exact reason for MDMA's rapid onset, long-duration efficacy, and dependence on the therapeutic setting to reduce PTSD severity is not known, but there are a few theories based on studies done in rodents. I will discuss them briefly here and elaborate in more mechanistic detail in the following video. One hypothesis is that MDMA can alter memory reconsolidation. Basically, whenever you recall a memory long after an event, parts of the memory become malleable. MDMA is believed to facilitate this for the emotional component of traumatic memories, and with the assistance of the therapist, the memory is altered so it is not as intense. As one patient describes, one thing that MDMA facilitates is thinking about traumatic memories in a neutral, safe manner. I can objectively think about them and talk about them. Then it seems those memories are put back in their place in the brain in a different configuration, a configuration that does not cause as many problems, such as bad dreams, intrusive thoughts all the time, or having horrible insomnia. This has continued to this day, a year and a half after the last MDMA session. Another hypothesis is that MDMA enhances fear extinction. Fear extinction is basically the process by which being exposed to stimuli that remind you of a scary event, but in a safe environment, eventually reduces the fear of that stimuli. This is the basic idea behind exposure therapies currently used for PTSD. It is possible that MDMA works synergistically with these therapies to enhance this process. As one patient described, "It allowed me to see my trauma without the fear or hesitation and finally process these things and move forward." One hypothesis that could explain the social dependence for MDMA's effects relies on MDMA's ability to indirectly stimulate oxytocin release. Oxytocin is a peptide neurotransmitter whose release in certain areas of the brain can promote social reward learning, as well as feelings of love and empathy. This effect likely plays a critical role in encouraging feelings of safety and their responsiveness to the support of the therapist. As one patient described, "You were sitting on a couch and there are two people in the room with you. They are the two people you have been meeting with and that you fully trust to guide you along this journey of self-discovery." Thank you for watching. MDMA shows clear promise in treating PTSD, and I eagerly await the final results of all the clinical trials. The prospect that this treatment could help alleviate the suffering of many people with PTSD is quite exciting. You can find the links in the description of this video to sources of all the information I discussed here, as well as links to a prior video I made about MDMA's molecular mechanism. In my next video, I will discuss in more detail how this molecular mechanism might provide more efficacious treatment than the current drugs used for PTSD.